Good morning, everyone. I want to start out by, again, thank you to everyone who's practicing their social distancing. Thank you for your kind words and all of your support. Yesterday, we indicated Dr. Ed Malenik would be joining us today. Unfortunately, a conflict came up with him, so we'll take another look at schedules and try to get him another time. With me today is John Woodrich, the Chief Executive Officer of Bryan Medical Center, and Christina, or Christy Nickel. She's the Director of our Clinical Laboratory. You've heard us talk about our frustration with testing, and we have received questions from both the media and the public. Christy's going to explain kind of some of the science behind it and the processes behind the scene that will hopefully, bring some light to what we've alluded to in the past. It goes without saying that we, our patients, and I know all of you certainly would like to see this quicker. Real quickly, numbers from Easy Visit, 7,600 have completed the screening questionnaire, 1,904 total Easy Visits, and now 864 individuals have used the COVID promo code. Our daily census is a 356. Again, we have 548 available beds. Testing at Bryan Medical Center, we have conducted 128 to date. 82 of them, thankfully, have come back negative. We now do have 2 positives tested at Bryan Medical Center. Pending results, there are 44 inpatients and 14. I take that back. So pending results are 44. 14 are inpatients, and 30 of them are waiting at home. Through our drive-through testing, we have tested 408 people for COVID-19, and there are now 4 positives rather than 3. So with that, I'm going to bring John up to share something with you.
Thank you. I'm John Woodrich, CEO of Bryan Medical Center. So to give you an update on the drive-through, as Bob mentioned, we've had 4 positives. We have 139 negatives. We're still working with our third-party lab. Personally made a call to their leadership to try to get this sped up. They are now going to be sending some of these samples to another lab in Phoenix to try to get our turnaround at a more quicker pace. I did want to explain something about the numbers. So as you hear numbers, both here and what you might hear happen in Lancaster County, I want folks to know that about a third of our inpatients are from outside of Lancaster County. So if we have a positive result on a person that's not from Lancaster County, that gets reported in that county. So if you hear a number here and you hear a different number from Lancaster County, it is determined by where that patient's residence is at. So we wanted to make sure that people were aware of that. Did want to make comment that our state lab continues to see or test or result, I should say, all of our inpatients, all of the patients that come through our emergency department, and then healthcare workers, first responders. It is the third-party lab that we're utilizing for our drive-through, and part of the reason for that being is just due to the sheer volume. We know that our state lab can't handle those from the aspect of we want them to really focus on those people that are more severely ill to be tested and those healthcare providers and first responders. I did want to make a comment in regards to the surge plan because we continue to work with all of our Nebraska hospitals, and I think this is really important. Our Heartland Health Alliance, we now get a report from all of those hospitals, about 50, of what their availability is for ICU beds or general med surge beds. We have a system that we put into place actually July of last year that we use for our trauma service. Now we have everybody reporting in by 2 in the afternoon, and we're able to crank out a report by 4 in the afternoon of all the available beds in the area. And the purpose of that being is that when we hit the surge, if we end up having to utilize those beds maybe for lower acuity individuals, non-COVID patients, we know exactly what the capabilities are and the staffing associated with providing care there. Or if we have a COVID patient or a potential COVID, if we start to manage them at that facility until the results get back, We know those capabilities. So I think this is really important to always remember that our goal is taking care of people all the way across Nebraska and the relationships that we continue to have with all of these rural hospitals. You know, we are all in this together, and I can't emphasize enough, please continue to listen to what the health department is saying to us, what you hear from our mayor and from our governor. I know people at times may say, do we really need to go to this degree? We're telling you, you need to. This is going to be the only way we're going to be able to flatten this curve and not overload the healthcare systems. We have seen results of what's happened in some of these major cities, and I think all of our officials are trying to do the best they can do to, one, protect our public, and to continue to manage the healthcare system from the aspect of not being overloaded with a big surge. So once again, please listen to these individuals. It's going to help all of us, I think, kind of run through this course and beat what's going on here in our community currently. I'm going to ask Christy to come forward now and share some information with you.
Thanks, John. My name is Christina Nickel. I'm the laboratory director here at Bryan Medical Center. I've been here in the lab for 12 years, and I've been in the laboratory as a medical laboratory scientist for nearly 20 years. I'm here to share some information about what's happening with testing, both within our laboratory and with the laboratories across the United States, including some of our reference labs. Just like many of the other labs in the United States, we've been preparing and planning for this for a while now. In February, we started looking at all of the analyzers that we have in-house that could potentially run the test. None of them had this test available throughout the country before this had happened, so a lot of these tests have literally been created since this outbreak. We don't have any capability to do that in-house right now. We have 3 platforms from 3 different manufacturers that would allow us to do that test in-house. However, we are not considered a hotspot. So what we're hearing from our manufacturers, and while it's a good thing to not be a hotspot, our manufacturers are telling us that they've been mandated by the government to not send supplies for us to do that testing in-house to the states that are cold spots. So we have been working towards a couple of different platforms. I know John's going to be doing some help with reaching out to some of the other lawmakers and helping us to, kind of fight for our challenges to get some testing in-house. That being said, we are constantly monitoring. Our reference labs are also being completely bombarded by samples. While we're not a hot spot, and that's a fortunate thing, it is also a drawback because we're not prioritized as highly as some of the hot spots. So with these labs receiving literally tens of thousands of specimens in addition to the routine testing that they do every day, they're adapting as quickly as possible, as are we. We are continually looking at what's the right thing to do for our community, what's the right thing to do for our patients and the drive-through and our healthcare providers. So we're working through every avenue that we have, working as fast as we can. I've heard a lot of questions about the 5 or the 15-minute test. The challenge that we have right now is these tests that are coming out are all under emergency use authorization by the FDA. The laboratory is mandated by or regulated by 3 different branches in the government, and the FDA happens to be the one that determines what testing can be implemented and used for clinical use. These tests that are coming out are not going through the rigorous process that is usually required as far as the testing that's done before it's submitted to the FDA for review. And then after the FDA receives the data from the testing that's been done by the manufacturer, they take anywhere from 6 months to 2 years to review that data before that test can be released in the United States. And that doesn't happen in other countries, so that's why a lot of times we get tests in the United States after they've gone live in other countries. That being said, they recognize that this is an emergency situation, so the tests that are being released are under emergency use authorization, which means they've expedited that process and are skipping some of the steps that would normally take place. That's making it go faster, but it's also making us question the accuracy of some of that testing, and we want to make sure that what we do provide for our community and our patients and our providers is accurate and makes a difference with what they're doing for patients. I think that's all that I have to cover right now for the testing part. But I do want to say, you know, I'm so thankful for being at Bryan Health right now. I'm so proud to be part of the team, and I mean everyone in the team, and that includes, you know, the medical center, my laboratory coworkers, the entire health system, and in addition to those that support us from the outside, like our manufacturers, the shipping and other transport or other support that we have, they've all been amazing. This couldn't be done without each and every one that's been involved, so thank you. So we have the analyzers that are capable of performing the testing, but the reagents and the pieces that we actually have to put on those analyzers to do that testing are not available to us in the state of Nebraska right now and any other cold spots that are designated that way.
Currently, we have no positive COVID patients in the hospital. We have 14 that are pending results right now. And we have had one individual test positive from outside of the Lancaster County.
Well, very well. You're seeing more of them around, and as you saw Larry with his mask on there, it's not uncommon to see people walking to the cafeteria now or through our hallways with masks. And again, those are coming from the clinical areas where they're required, and they're practicing strict conservation measures, and everyone's really kind of doing extremely well and very compliant with it. Well, thankfully, we're not running out of money. We have been very responsible in our reinvestments into the community, and certainly our strong volumes over the past 10, 12 years have put us in a strong position to where we can fight tooth and nail for our PPE and take care of our employees during this time period. So thankfully, Matt, we are not in a position of where we are running out of money. Obviously, the budget will be broken this year. There's no doubt about that as we respond to this, but we're on solid footing here.
Yes, we've had a few staff members isolated, just the same as it would be if any patient presented here. If they show any of those symptoms, we ask that they stay home and isolate. It's the best thing to do, so we have to practice what we're preaching as well. We have had one staff member test positive, and that person is self-isolating at home.